chiropractors out there don't do traction or exercises because they can make a lot of money, because the adjustments get people out of pain and that's what people want. Most doctors don't do rehab because they can give somebody a drug. It's the easy way out. We don't take the easy way out. We want to be the best. And so that's why we go and we get 50% better results than any other clinic out there, because we do. I have people come to me because they go, "You're the only one who does traction." You know, not many. People don't get excited about this stuff. It's not sexy, but I do because I think it's cool. So when you have a patient and they come in, you always recommend the exercises and the laser to go on it. We typically like the laser 2 times a week, but if you had a person who goes, "Money's no object, I want the best results," do it 3 times a week. The laser has a lingering effect. You juice it with the beams, the mitochondria go nuts, but the effect lasts for usually 48 hours. So 5 minutes on the laser, 48 hours is good results. So if you're doing it, and we like Monday, Wednesday, and Friday. Now, stretching, the traction adjust. Now that's what we're talking about today. We're talking about how to effectively use these tools. Okay, so adjustments work really good in the beginning, and if you have access to a chiropractor, you can, and you're working on a knee and it's a ligament injury, go to the chiropractor, say, "I need you to add that to your treatment program. Say for the first 2 weeks, I want you to adjust it twice a week. And then the next time, then once a week," whatever you want to do. But remember, adjustments are very good in the beginning, but they do lose their effectiveness. It's diminishing returns. You know, they work really good in the beginning to get fast results. Are they good for you in the middle and at the end? Oh, absolutely good for you, but not nearly as good as they're not critical. The traction is not very useful in the beginning. Is it good for you in the beginning? Yes, but it's very hard to do. So it's very not helpful in the beginning, but it does work. It's just, if that's all the only tool you have, you're going to get worse results. It's critical at the end. See? And exercises are not, they're careful at the beginning, they work okay in the middle, but they work really good long term to maintain. Mainly because you can do them at home and they're free and they're easy, right? So we want to add exercises and stretching. When I say traction, we can do a slow stretch. So basically the rule is this. When it comes to exercises, you want to start them within the first 2 weeks. So you do the first PRP injection and you start them with an exercise, okay? And I don't care what it is. Go Google an exercise. Go to Hep2Go and pick an exercise. The key isn't which exercise you do. It just has to be that. So if you have an infraspinatus, you can go on there and say, "Give me 10 infraspinatus exercises," okay? Now, at this point, it's all about 3 things. One is it should never be painful. If the exercise causes them pain, don't do it. Now, when I say pain, you got to be really clear. I'm educating you the way I would educate a patient, the way I do educate patients about it. I go, there's 3, I use rules, and I always number them, and I make them memorize it. What are the 3 rules? The exercise should never hurt, ever. And when I say hurt, I don't mean while you're doing it. That's usually a bad idea. It can hurt while you're doing it. It can't hurt afterwards or that evening or the next morning. Now sometimes a patient will come back and say, "Didn't hurt that evening, didn't hurt the next morning. It hurt 48 hours later or 24 hours later." It wasn't the exercise then. You did something. So don't let the patient